yeah, sorry, press that button. Okay, hello and welcome. And again, very sorry for all the technical difficulties, but welcome to everybody who's here and anybody who will be watching this in the future. We're very grateful to be able to be working with the community on these community forums for the comprehensive plan. Today's meeting is about community facilities. We've got Tim Jenkins here. Come on up. And he's our facilitator. He's from Langford and Associates, who's managing the grant program and the comprehensive planning overall. And I'm going to let you do the introductions, and we'll get you started on that. Thank you.
Okay, we'll give you a little status thing here in a bit. We started the comprehensive plan under Resilience Community Programs last spring. To date, Smithville is the second community that's passed milestone 2 for the entire state program. That's hundreds of plans that are underway. We snuck in Wimberley in front of you. They're kind of sensitive, so we made them first, but you guys were a strong number 2. So by now we've got, after you, we've gotten 3 other communities to milestone 2, and I'll describe it here a little bit. But just to give you the sense that this isn't something that's just kind of fumbling along. We're on a solid progression line. You're ahead of other communities in the state, and we've got such a great combination of inputs that we're getting both from our a designated stakeholder group, informal community inputs, and these forums are outstanding. So we're listening, we're getting it, it's getting processed, and we're about to start writing the plan actually. So go ahead.
I'm so sorry. I'm a horrible hostess. So just to say thank you again to everybody here, but thank you to our guests here. So we've got Cheryl Burns from the school district. She's our superintendent of schools, and congratulations, because May is her retirement. So thank you very much for being here today and continuing the good works. Yeah. We've got Jace LeBlanc, who's from Towers Nursing Home. And I hope each of you will say a little bit more about yourselves, because I'm a little discombobulated, and I apologize for that. But from the nursing home, again, as a community facility, we thought that would be an important one to bring to the community to talk a little bit about what's going on. And Jace Jones, who's with Seton Ascension Smithville Region, your Regency, Seton Smithville, Ascension Seton Smithville Regional Hospital, right? Thank you very much. As being one of the top administrators are all here from school district, from Towers Regency, and from Seton Ascension Hospital. And of course, and Edward Balsek, who's here with the city of Smithville. He's our public works director and kind of oversees basically pretty much any kind of infrastructure stuff that goes on here. And so just so thank you for everybody. Thank you, all of you, for being here and being such fantastic stewards of all of these community facilities. And I did want to just call attention, Sandy Meyerson's in the audience too, just as to kind of piggyback with Edward about talking about the airport as a municipality community facility. So, and thank you all to everybody who's here who came as community members, and Council Member Jenkins. Oh my gosh, see, he's here to observe. So thank you for being here. I really appreciate you all. Okay, back to you. Thank you.
All right, thanks. Neat. We're going to go over kind of some slides, demographics, basic stuff, kind of just to get the stage set and all of us talking the same language and agreeing on numbers, et cetera, about future growth. Can you do the next slide? So we were talking about this before the introductions. So this is the progress. You can see we're at months 3 to 12, where we've hit the milestone 2 package. See that down at the bottom, it's been approved. What that package includes is all the base studies for water, wastewater, streets, drainage, population study, housing study, existing land use analysis. We've done all that. So Uh, in doing that, we've written a lot of the chapters already in the plan. We got to get them formed up for review. That's our next step. So you can see through the timeline there, this summer we'll be deep into the preliminary plan and writing and revisions. We're going to deploy over the next couple months, hopefully within a month, the actual engagement tool that we're going to use online to basically have the continuing review and conversation and getting your input into the plan. So we're not going to just send you a PDF, ask you to review it. It's going to be something that the tool will capture everybody's input, and we'll all be just the stakeholders at first, but then we're going to open up to the general public once the stakeholders are comfortable that those chapters or that section of the plan should be looked at for the general public. And from that, we may end up doing some more of these forums to kind of go more specific, like on Parks and Rec or something that comes up while we're doing these forums. We may need to do a deeper dive into something like downtown improvement district, things like that. Don't know that yet, but that's the cool part of this as we go and kind of get familiar and do this analysis and start writing. Things are kind of showing themselves already about some real needs for Smithville for planning purposes. So, well, right now we've also launched. We also have another planner that's doing our zoning and codes review for you. So pretty soon we'll have some results from that we'll be posting alongside. So it's got to be kind of parallel. We'll be writing comprehensive plan, then also reviewing zoning ordinances, building codes, all that with the idea of resiliency. So at the end of that, we'll have recommendations. It'll be decision point, you know, that the city's ready to, there's enough changes that these guys are recommending that we might want to do a new zoning ordinance. That may become a new initiative that comes out of this. But at the end of it, we're going to be giving you a capital improvement plan and then recommendations regarding your zoning. So that's the boring stuff. I just wanted to get you all comfortable about what your role in doing these forums is. We really appreciate you, especially you guys that are here all the time and helping this thing keep rolling. So what we're looking at is by next fall, having the draft preliminary plan, having the code zoning and codes review ready, and then also the draft capital improvement plan. And then at that point, we'll try to go final, and then by this time next year, be talking about the final plan. This is, you know, it seems slow maybe to some, but that's pretty accelerated rate. And because of the participation, we're able to do that. So thank y'all. Okay. Just to get started, some basic things. We had a population estimate of 3,980, 2022. It's slow growth, but steady growth since the 2020 actual census, which was 3,922. So that's about 1.4% population growth median. And then those bullets got stuck together. Then you got a median household income change, which is something to keep an eye on. It's only 1 year though, but there was a decrease in median household income. So that's not saying it's a stagnant economy. It's just, it's not something, you know, some places it's an obvious growth because a new industry, new jobs, things like that. What else are we looking at? According to the 2020 census, there's about 1,900 households, or sorry, housing units. That's different than households. So that includes apartments, rental units, anything that's occupied or occupied or non-occupied. The difference, family living rate households is 1,666. So the difference in that is that, like we were just talking about, where a household is occupied with a family unit that's defined in a number of ways. It would be two people or an household, even if they're just two buddies renting a house, that qualifies as a household. Or families that are here, it's mainly single family, uh, average one to two kids. That's pretty standard throughout the state. The household income's 56,630. Again, that's a little higher than a lot of the communities we're working with now. And employment rate's good, 67%. And that's the 2022 American Community Survey, which is an official thing. It's the census trying to fill in the gaps between the 10 years between the actual official census counts. So they do estimates throughout the decade in between, and that's what these are. Health is without coverage is 13%. So that's a vulnerable population that we want to keep an eye on. And then what else we got? Commutes. That's almost the average nationally is 30 minutes to commute. So any other of these things y'all want to bring up, or we can go to the next one, which is housing. As again, this is not telling you something you don't know, but it's times when you're talking about facilities and locating and strategies about that, and what populations are you serving with these community facilities, it's good to know where you have concentrations of housing units. And again, no surprise, but mainly existing Smithville as it's been for decades. And then some more, growth on the west side and anticipated growth to the southeast. Some other things that we've already got in our land use analysis and our draft land use map, but we're still working that and fine tuning it before we trot that out to you. Business is concentrated downtown. I don't know. Housing. Yeah. So median property value, 222,000. That's 60,000 less than the national average, but a little pretty close to the Texas median household average. So that's not something to be, oh yeah, our property values are going down. This is interesting. Again, a concentration of businesses along main arterial roads in downtown. Otherwise, there's not a lot on in the growth area that we're, like I was saying, the planning horizons to 2045, so that's 20 years. So we're planning not just the city limits area, but parcels that are outside the city limits. And the significant thing in this one to me is the companies at the airport, the businesses. I know I won't go too far. You have to stop me because I'm ready to do planning already. But that obviously is something strategic that could be taken advantage of, especially with the airport's location and the way you guys are going about your expansions and everything is very, I'll tell you, compared to other small airports in these communities we're with, this one's the most promising one that I've seen. Other than the one in Port Aransas where I was the planning director, but it has a head start on, the guys coming down there. The first map you have is critical facilities. And this is a rough map. This comes from the county hazard mitigation plan. And this was done 2022. These plans are done every 5 years. And it's a county plan, but it also accounts for the entities in the county. So this is the map for Smithville's critical facilities. You can see the legend over there. We were talking about what's a good map for you guys to be able to kind of work off of as we discuss what we're about to. And this is the best thing I could come up with. Plus, remember our community plan is a comprehensive, not just comprehensive, but a resiliency plan, which is meant to also bring in community adaptability, the ability to bounce back from a disaster. That's the simple explanation of that. And that includes having redundant systems in place, like for your communications, redundant facilities. If we identify the high school as a evac area and we get flooded, we may need to change that and have an alternate site in case that the primary site gets flooded. We need a secondary site identified. So keep that in mind when we're talking about facilities and locations, and not just the role they play for your functions, but what they might play for the community in response to a disaster. And then we have, I got the boundary map. This is from the county CAD. This is the best I could do for the schools, Cheryl. But the other map has the locations, but not the names. And that's, so any observations, anything from the general setup? All right. So okay, we got to roll. You want to do the open floor or do the specific questions? Okay. So we all got together, we planned this and came up with some questions we wanted the panelists to ask, and then we'll have an open forum for questions after that. So we'll start right to left. Cheryl, what demographic changes are you seeing and how will that affect the facilities that y'all manage?
Probably one of the biggest changes right now is our emergent bilingual. Okay, so one of the biggest things that we're seeing right now is our emergent bilingual. We in 23-24 we saw 17.5% increase, and then this year we've seen 8.5% increase. That is pretty significant in the school business to see that kind of population grow. And then of course it brings about several different facility concerns that we need to have, or productivity for them. The other thing that I wanted to bring to y'all's attention is we have right now an enrollment of 1,834 kids. But within that, we've seen an increase in students coming in that do not live within our property lines. So they're transfer students, and many of them are coming from surrounding districts. And because we have an open enrollment, then we allow them to come as long as they meet the criteria, being attendance, discipline, different things that the Board of Trustees has set up as criteria for us to use in determining whether or not they can come to Smithville ISD.
Oh.
But we have seen an increase in the transfer students. So that's going to make a difference when the population of students that we have. So the other thing that might be interesting to y'all is that we have what we call a McKinney-Vento Act that we have to follow from the federal government. So we collect data on children that are considered homeless or in houses that are doubled up. And so we've seen an increase in that, where we have more children that are coming in that fall into the criteria of McKinney-Vento. And so services and support that we need to give to them. So I figured this particular group would want to know that.
What, given you get transfers in, how do you account for funding them from a limited school district? Yeah,
Well, we do receive funding from the state on
that,
student
okay.
attendance. So they are within us as far as our enrollment at that point. The other district has to go without their funding
Oh, okay.
per student. And right now, we're looking at about 6,100 per student that we receive. The only one of the things that happens though is we do have a 1 to 22 ratio kinder through fourth grade. So if any of our grade levels during that period go over 22, then the transfer students, we do not allow more to come in. Just because that's the legal requirements for us, and we'd have to request a waiver to get more in a classroom.
Oh, okay.
1,834 as of Friday. The other thing that happens with the school districts is that funding is dependent upon percentage of attendance, our ADA, versus the enrollment. So that is something that we have to look at on a regular basis as far as funding the facilities, the staff, anything that we're having to do for our students. So
Is there a ratio that kicks in and if your average daily attendance is?
no, it's strictly on that. So
enrolled?
if you're looking, for instance, we've gone down before COVID, we had probably about 95.6% attendance. And then as I look at that I look at it every Friday. And so last Friday, we were at 91.4% attendance. We don't want the children to come to school sick, but in the same token, we have to be aware of the fact that it costs money. Just last month in January, I believe we lost about $134,000, give or take a couple, based upon attendance drops. So.
Questions first, or you want to look?
Oh, okay. That's probably a good way. We'll just take each category and
Can you tell, I'm Monica. Can you tell us more about the homeless population of students, like the numbers we're looking at and the age range?
They range all different. Many families have anywhere from elementary and junior high and high school. A lot of the high school students are what we call doubled up. They'll go find another family to stay with if they need to. And numbers, from any one year, you're talking about maybe 25 kids. But to us, 25's a lot. And then when you go up to 35, that's a significant increase also. So we're not talking about hundreds, but it's enough for us to be concerned about.
any other. All right.
My name is Jake. I'm the administrator over at Towers Nursing Home. One of the big demographic changes that we've seen is kind of just to piggyback on what Cheryl, it's before COVID, people would show up to work very frequently, very regularly. After COVID, it's been, having to deal with the workforce population. We, being in a rural area, we build and we kind of train our own. We develop from CNAs to medication aides to nurses and go up that rung. But we've seen a lot of people kind of get out of the medical field as in it's too taxing on them. COVID was very difficult. A lot of our nurses quit and went to go be hero nurses traveling to New York and a lot of the very densely population areas that had COVID very bad. And it's been fun trying to rebuild that with younger people that lack the experience of our older workforce. As far as our census, we haven't really seen a change since our facility's been built. We average right around 116 to 118 of our average daily census. Our capacity is 120, so we stay pretty busy and pretty full. One of the things that we are worried about is the baby boomer generation. There's just not going to be enough beds for everybody. So that's something that, we do worry about. And it's, as population gets older, are we going to have the workforce to take care of everybody?
Yeah, that's the other trend we're seeing is you know, and it's a national issue about how do we replace population? Throughout centuries, it's been by natural growth, you know, it's been having babies and families staying in place. And we all know the trends on that. You know, if younger couples are waiting later to have children or not. And it's impacting across the country. And all us small communities have to think about how we're going to draw and attract young families rather than anticipate there's already, because you don't already have a bunch of young couples living here
Well,
ready to have kids either.
struggles is not every family that lives in this area has the support of, you know, multiple families that they can reach on. Hey, can you watch my kids? Hey, this, you know, I can tell you from a personal example, it's if I have to take my kid to school, I lean on my parents. I lean on my mother-in-law, my father-in-law. And when they're not able to, then it's like, oh, well, I'm going to be late to work. I like it rearranges my entire schedule. And it's, you know, what does that look like for our frontline staff that, you know, moved out to Smithville for, you know, a easier lifestyle, but moved away from their family, moved away from their support structure and don't have that childcare available.
Wow. Yeah.
Monica again. So I have quite a few friends whose parents are much older and in different stages of either physical decline or mental decline. And in the last couple of years, they've had to make decisions to put their parents in facilities. And everyone I know doesn't want their parents at Towers, so they send them to Argent and Bastrop. And I'm wondering why that is, or are they just completely different kinds of facilities?
They're two totally different types of facilities. Argent Court is a assisted living where Towers Nursing Home is long-term care. We have 24-hour nursing coverage where Argent Court is more of a apartment style living where they have some medical personnel there or on call. Mine are kind of like a hospital. I have nurses there 24/7. The difference between me and Jace is he has doctors as well. My doctors visit, but my nurses are there. The other struggle is I have about 80 beds that are allocated to long-term care and they're full. So the struggle that I'm going through with Dr. Wilson is we should have built a building twice the size, but we didn't foresee that being an issue when they built the building back in 2019.
Hi, Jay, my name is Pamela. Do you foresee that because of the situation where it's hard to train or to get people in to train them to stay at a long-term care facility as far as employees, do you foresee a lot of families keeping their families members at home, doing home health? And how will that, do you think, will impact our community?
So home health doesn't come out and they make a few visits, they check on you, they go their way. It's home health is not a replacement for long-term care or assisted living. We have seen culturally, many different cultures will keep their families home and it's just part of their culture, part of how they were raised. But a lot of families are now seeing more and more, it takes a village. It is very tolling on caregivers and often people go into caregiver burnout. I know a lot of my staff go into caregiver burnout. We have to, you know, ensure people are taking PTO, taking time away to take care of themselves because it's very difficult taking care of people. We see, you know, some people are wanting to stay home with their loved ones but then we also see the change of this isn't mom. This isn't the mom I knew. This isn't the mom I grew up with. This is a different person. No, it's the same mom. It's just the process of the disease. So we are seeing some trends, but you know, we're here to help the community however we can, whether it's placement at Towers or whether it's placement at Argent Court, New Haven, or any of the other facilities nearby. We just want to be a resource to the community.
Well, with that being said, do you believe in order to find the workforce that home health, well, not home health, but the health as far as nursing care, they need to increase the pay in order to maintain those employees?
I can say that I've actually had several conversations with Jace where I'm like, hey, confidentially, what are you paying your nurses? Making sure I am competitive and that we are staying very competitive. I know I outpay several nursing homes in the area. When I first came to Towers Nursing Home, Dr. Wilson's predecessor, Mr. Hector, wanted to increase the hourly rate of our floor staff up to $12 an hour. I can tell you there's not a single person in my nursing home that makes $12 an hour. They make significantly higher than that. We understand with the change of COVID, we have to be more desirable. It's the average commute, he just said it's 30 minutes. I drive an hour to come to Towers. People will drive to find a better paying job. So not only do I have to compete with my sister facilities within the same county, I'm having to compete with Houston. I'm having to compete with Austin. And I even have people driving in from San Antonio. I would rather grow my workforce here. I'd rather teach someone how to be a CNA than pay for them to go to school to become a medication aide, pay for them to go to school to be an LVN, and then even an RN. And that's what my company is starting to do with the change over to a nonprofit. We are trying to reinvest in the healthcare workforce. And we are having better luck growing our own than finding someone that's coming in off the streets.
When you say growing your own, what's the demographic of that? Is it people that are changing careers or?
Some
the
people
first career?
changing careers, and some people it's school's not for them. We're helping them get their GEDs, or they just graduated high school and they just they want to love on people, but they don't know what that looks like. So we teach them how to be a certified nurse aide. We actually pay for them to go to school. They earn $14 an hour to sit in school and learn how to be a CNA. And then we pay for them to become a CNA, pay for their state exams, and then give them employment with no strings attached.
Where is the schooling?
So we actually have a partnership with Career Tracks. I'm sorry, I'm not talking into my microphone. Where we're using the Methodist Church here in town as part of, because we just outgrew space at Towers. My 55,000 square foot building's not big enough. So we reached out to the community. The community has lent us part of the Methodist Church to teach, and we have 2 CNA programs that we do consecutively. And we are growing CNAs left and right. I have one class it's 5 weeks long, and about every 6-7 weeks, I have another class. And then I have one lady who teaches a 12-hour class where she goes to Galen to become an RN. She's teaching the class, and it's 3 days a week. You meet for 12 hours. They do that for a total of 120 hours, and they get you to be a CNA in about 2 weeks. And all of it's paid.
Wow. Jace, you got.
Well, I'll echo what he said about the workforce. Post-COVID, it's been a learning opportunity. Where we have gotten lucky, and I hate to make light of some unfortunate circumstances, but the closure of St. Mark's, they had a lot of employees that we were able to pull several from there, both here and at the Bastrop location. We also are lucky that there are a lot of couples moving out from the Austin area because of the high cost of living. A lot of them are nurses. We even have nurses who drive in from Austin to work at our facility, much like Jake. Our issue with staff recruitment is, and growing their own, what I've always found is, does their spouse have a job in the area? Because if their spouse doesn't have a job, they have to move where they can both work. and nursing, CNAs, that's a highly adaptable career. There's lots of opportunity. The other thing about getting young people into healthcare is Buc-ee's pays $18 an hour to start. McDonald's pays $18 an hour to start. So you're trying to fight with them a little bit on how healthcare can be a long-term career. You can go lots of different paths within healthcare, even nursing homes. We're all kind of in it together as far as staff. The other thing is the newer workforce, starting out with the company and staying their entire career there is foreign. Like right now, I've got a imaging student from Blinn. She did 4 years at A&M, graduated, something, I think, agriculture. And then she woke up one day and decided she wanted to get into healthcare. And so now she's learned to be a radiology technician, but she can't confirm that she will stay working in a hospital, anything radiology for the rest of, so you kind of face that. Where do you go? How do you get people? And that's just part of it. So we try to offer for our employees the ability to move up, right? If you want to try a different area, let's see how we can get you there. And unfortunately, sometimes they have to drive to Kyle or Austin facility, but it is available. Jake and I trade staff quite a bit. He trains them up as CNAs. We hire them as nurses. Then they go work for him and they just kind of come back and forth, but it is burnout. You know, it is a lot of burnout. So as far as the patient wise though, we are seeing a lot of older retirees that are not from the area coming in, people who are trying to establish with the physician. We have seen an increase in pediatric patients, mostly in the ER for simple things like cold, cough, flus. And then we are seeing some of the middle-aged couples that are new to the area and they work from home, but they're relatively healthy. You know, they don't really come to ER. They don't need a lot of surgery. Most of the time it's for screening procedures such as mammography or colonoscopies, lab work. But other than that, they're fitter, they watch what they eat. So it's kind of a dichotomy as far as that. So they can get to the gym or they have home gyms, when they moved out, the home gym.
Where my wife's headed, she works from home.
COVID really made everyone self-sufficient at home, and it really created more of the remote employee. But unfortunately, in our industry, we have to have hands-on employees.
Yeah.
I will say one area workforce for us is physicians. Jake's right. I have to have physicians to see patients. That's really tough to recruit. That's, housing, schools play in. Does their spouse want to be in the area? You get lucky if they're from the area or their spouse is from the area and they have family in the area, but more than not, you are racing against the clock towards a bigger city that has quote unquote more things to do.
Yeah, I remember in our land use planning with the stakeholders, that became a really interesting topic about what type of residential development do we need to bring to Smithville to draw those kind of professionals? And, we're strategizing as we write the plan, but thanks. Any questions from?
Yeah, I have a question about, y'all have like a retention plan? What is your retention rate for your staff? I mean, you said
It depends.
they go back and forth. Well, I think there's some societal problems that y'all can't control, like the nuclear family versus the extended family. You're talking, you have to depend on your in-laws and stuff.
The retention
kids.
really depends upon the worker's age, right? So I've got
Their heart.
a workforce who Julie Miller, my director of nursing, she's been with the Smithville Hospital for 23 years. She lives in and around Smithville. She's not ever planning on leaving. But I've got newer workforce who, well, let's work here. I had a great nurse from Louisiana. She moved here because her cousin got married here, loved the town. She worked, maybe a year with us and then something else came up. She thought, well, why don't I go live there and see what it's like? So you can't really retain those type of employees, right? I don't have to worry about retaining my long-term employees. You know, I've got employees who I guarantee you, I'm gonna have to have a hard discussion with them when they're 85, pushing their own walker while trying to take care, but that's just the difference in the workforce generation.
Exactly. So the work ethic versus having the heart for
No.
the job versus the wanderlust for looking to see what else is around.
I don't think it's work ethic. I really don't, because some of the younger workforce, they work just as hard. It's just, how do they balance work life? You know, life is no longer work. I want to have more life experiences than I do being tied to one spot. And it happens in physicians now. I mean, it's just part of that growing wave. So I don't think it's work ethic. I think it's just what they value more, money or their ability to go and have experience.
Ed, how are you seeing demographics changing the needs for public facilities?
So in a lot of our public facilities and stuff, one thing I see with all the growth coming through and everything is just trying to stay up and maintain everything here. We're doing the wastewater expansion because, we're getting to that point in our life where it's, we're going to have to start either getting ready to build or add on and stuff. Water, we're looking at upgrading lines, electrical, stuff like that, just because there's so much growth coming in. And, one thing I see we're going to have a problem with is I need people. We're going to need more people to work here for the city. We're going to need more machines. We're going to need more vehicles, more stuff to get these jobs done and stuff. And it's getting to the point where it's getting hard, and things are very expensive these days and stuff. So we're needing it. But yeah, I think just like I said, getting everything maintained around here is a really big change coming, big deal.
Yeah, it's a challenge to, maintain what you've got, sustain,
Mhm.
What Smithville is right now, and you not have too much of your community energy go to the outskirts.
What we were doing 10 years ago to what we're doing now, and we're asking the guys to step it up and do more and more and more, but we're still paying them, we've moved up in the world since I've started here 10 years ago, but like you said, I've got a lot of young guys here and stuff, and I usually have to hire close around Smithville because of us being on call, making sure we always have the water running, the electric running, everything going. So I have to have everybody on call. Some people, the younger ones, they like to leave and go for the money. They come here, they get trained, and then they leave and they go and, somewhere else where they can make a lot more money, and which is fine. But the city here is a real good place because, like I said, with the benefits and everything you have for especially somebody like me, older I'm getting, the more I need all of that, and stuff. So I like it. But yeah, it's tough to keep all these guys around. And kind of like with these guys, I don't think it's a work ethic. They like to work. They just want the money. They want the money. Yes, ma'am.
Do you believe, from doing an analysis, that we, as far as Smithville, when it comes to public works, are competitive with our counterparts in the county, like Elgin and Bastrop? Because I heard you say that they come, they get trained, and then they leave for more money. And I know that's the way it is in healthcare as well, because COVID just kind of squashed that, forum that everybody had, because they paid more to get the help. So do you believe that Smithville is competitive in their pay rates with the other people that are in our county?
Yes, we are. And by doing that, Robert, did do an analysis on it over the, past 2 or 3 years that we've been here, and we are real competitive with them. We've moved up and got to that point where we were. Yes, we were not back in the day, but we are now.
We can kind of. Oh, any other questions?
Yeah.
Oh, well, no, but they've covered about 3 of them, so.
But the actual
Yeah.
facilities, and
Yeah.
what's going on for facilities.
Yeah, we talked people mainly in this first round, so let's talk facilities, since that's our topic today. People drive the need for facilities, but do what do you have for capital improvements on your radar in the next, I won't say 20 years, that's asking too much, but say the next 5 to 10 years? What?
For an ISD, we have to have kids first. And just the way that things are funded in the state of Texas, we have to show an increased number of students to be able to get more funding. And so, but right now we are doing a facility review again, because we want to be prepared for growth that comes every time you bring in a subdivision. Let's say there's 30 houses and 15 of them we expect to have children in, probably 2 to 3. And then you have to look at what is the potential growth of the facilities that we're going to need for that growth. We know that our junior high that we just built is really at capacity. And we know our high school that we built 20 years ago has got portables now. So we did move our first and second graders out of Brown, but there'll be some renovation that has to be done down there if we ever bring kids back to those extra buildings that are down there. So, we're in the point of just reviewing, looking. The hardest thing will be the fact that we have the property out there where the junior high and high school are, but it is considered to be in a flood zone right now. And so trying to build out there, even though there's a lot of property, trying to build out there would be significant for the watershed. So
It's going to become more difficult.
and it will be. So then where we're at now is, where do we build another facility? Do we go out towards 304 where potential growth might happen? Do we find property to the north? So that's the kind of thing that they're going to have to be looking at over the next few years. As I said, we'll be utilizing a demographer to help with some of that discussion.
Right.
So
How long do you think the review's going to take? Because we'd like to write it out.
the facility review will take probably about 2.5 months. They'll
Oh,
start.
okay.
next
That's
month.
within our.
Yes, I'd like to have it done before I leave. And then as far as the demographer, then that'll be probably up to the next superintendent to be able to put all of that information together for our board to start looking at what are we going to do future. A lot of it also just depends upon what the legislation comes out of this session as far as funding goes, where we go with our facilities also. But we're planning, we're looking, but ultimately we are looking at our numbers. What does the enrollment look like? So.
Any questions about schools? What are y'all looking at building
I can
or
tell you,
expanding?
we have a very, very new facility. Hospital board built the facility. We opened up November 4th, 2019. So we are 5.5 years old. I know that the hospital board has asked, what does it look like for more beds? I've brought that up to senior management. They kicked the can around the road to see what that would look like. And it's a matter of how much land the hospital board has that we could add on to, about just, logistics cost and what that looks like, the partnership with the hospital board and
At the current site.
at the current site. I don't foresee there being any current or any new plans on building another facility in Smithville. I know the hospital board has asked for assisted livings, but the big concern is, even with new facilities, it's going to be workforce. Do we have the people to staff?
Yeah, empty buildings. That's, don't need that. How about you guys?
Well, so we're actually, how we plan for the future is based on workforce, but it's also based on insurance companies, right? So, for instance, Medicare right now, they consider a total knee replacement an outpatient procedure. So the days of being admitted for a week or 2 weeks and getting your therapy, they said no. And they've come a long way within knee replacement surgery that you are up and walking within an hour. A lot of insurance companies now are focusing more on the preventative and the outpatient side of things. So we would rather, the insurance companies would rather reimburse us for more outpatient and not an inpatient stay. Right. Now, they will, but you have to be really, really sick. So for us, we're kind of like Jake, we're a little out of room. So we've done a good job of recruiting physicians. We have an orthopedic surgeon, we have a general surgeon. We've got some nurse practitioners. We're working on recruiting family medicine, internal medicine physicians, but they're in the back wing of the hospital. So if I want to increase my bed capacity, I can, but where am I going to put those physicians? On the other hand, we received a grant from the Dan Duncan Foundation to add nuclear medicine. So we're in the planning and designing phases of what we have to do to our existing building to add the nuclear medicine machine. So we'll be able to do some heart scans, exercise stress test. The other thing we've noticed is our cardiac rehab facility in Bastrop, it's at capacity and we don't have the space in which to add out there. And we've noticed a lot of our cardiac rehab patients coming from north and east, so Giddings, LaGrange. So do we add that capability here on this campus location? The other thing is our ER, the emergency rooms have become the new clinic. And we have 6 beds, 1 trauma room, and our EMS arrivals have gone up 108% with the closure of St. Mark's.
Oh.
So
Bless the Anna-Curse.
that's exactly right. So we get a lot of EMS from Lee and Fayette County. And that can be really bad when you have 1 trauma room. Right. Yesterday, 2 days ago, we had to fly 2 patients out. That's the level of severity of the trauma. None of them were from Bastrop County. So we've got to look at ER. How do we add those capabilities? But the board, they built the hospital great when it was built 1995, I think, from the original. Earlier than that? Yeah. So, but now, and the good news is with Bastrop, the city growing, you've got a lot of people living in between. So a lot of those out of district by the way, my daughters are 2 of them and we're happy to be here. So
Yeah.
how do you kind of plan for that? Luckily, Ascension Seton, we have relationships with Dell Children's. That's a hospital within our family. We also have the Dell Seton Medical Center, UT Austin, which houses a whole host of residency programs. So we're trying to work with them to bring those residents out here. We signed an agreement with the Texas A&M College of Medicine that medical students will actually come and live in the community with us and shadow our physicians. So our hope is you got to start early. So we're trying to entice them while they're still students. They still have to go away for 3 to 4 years for a residency in family medicine or internal medicine. But the hope is they enjoy so much time here, they come back. So just looking at lots of options. One thing we were pursuing was a grant that would allow for a pediatric caravan. So it's a mobile pediatric bus that could hopefully ease some of the ER visits. You give free shots, physical exams, and park it at different locations within Bastrop County. Yeah. But HRSA said we did not qualify. What we learned is Smithville is no longer considered rural. Yep. Because of Bastrop. Bastrop County is now part of the Austin, Round Rock, Georgetown metropolitan area. That's exactly right. So we feel that we're rural and we say that in a good way. But that's kind of the challenges we're facing. Probably 5 years ago, we would have not had a problem. However, now we're kind of in that in-between stage, but they look at the county as a whole.
Yeah, our office is in Liberty Hill and Judy made that choice back when we set up there because we wanted to retain, hey, our offices are in a small community because that's our clientele. Not anymore. Anywhere we go, it's like, well, you guys up there in Austin, and we're like, no, we're not. We're Liberty Hill. It's just takes it all in, and that's an interesting change, though.
Question. So since you're seeing so many people in the ER with the coughs and colds and things that don't really need ER, do you, when they arrive, do you encourage them or provide them
I
information?
cannot, I cannot. So there's,
No, okay. There's not even information available about the community clinic
there
there?
is upon discharge. So
Okay.
by law, there's a law called EMTALA, which is the Emergency Medical Transfer and Active Labor Act.
Mhm.
So regardless, we have to provide a medical screening to a patient regardless of their ability to pay.
Right.
So I cannot tell people upon check-in of the resources because they could then say, oh, well, I'll just go there, which is a violation of EMTALA. So we have to provide a medical screening, we have to treat them, then we can provide those
Yeah,
resources.
I'm sorry. Maybe I didn't phrase that well. I wasn't suggesting you turn people away. Just encourage them in the future to use the community clinic as much as possible to free up resources needed for more true emergencies.
You can lead a horse to water, but you can't make it drink. That has been, I wouldn't call it a struggle, but that is, you can look on social media, tons of healthcare systems out there. They have social media posts about what's suitable for urgent care, what's suitable for hospital ERs. But at the end of the day, I haven't seen that too effective. So we try to educate, we try.
Do you know what the sort of the roadblock there is? Like why people don't look at the community clinic as a resource? Is it too difficult to make an appointment or?
I don't know that. We don't ask those questions about that.
One of the things that I've seen is everyone has this idea, the ER, go to the ER, I'll get fixed in the ER. There's a lot of times that you can go to, like, for example, with our residents, I have a nurse practitioner, a physician that will come in that will provide 90% of the same care that you would get at Seton Smithfield in-house. But families are like, no, we just want to go to the ER. It's the stigmatism of the ER will fix everything. And it doesn't matter how much social media, it doesn't matter how many, there's a comedian now that goes up and it's just like, tell me why you went to the ER and I'll tell you why you were wrong. It's just that we have to get away from that idea, and it's not anything against the ER. It's just, they're busy.
I would say there's also this stigma that if I go to the ER, I don't ever receive a bill. Because of EMTALA, we have to treat you regardless of your ability to pay, right? So I think that makes some people think, well, because I don't have to pay when I'm there, I won't get a bill. And then later they call me or they show up in the office really upset about their bill. And what people don't understand is ERs are expensive because I have to staff that 24/7, 365 days a year. I don't get to close because of bad weather. So I've got a physician 12 hours at a time. I've got to have a minimum of 2 nurses. We've added a 3rd nurse. I have to have a respiratory therapist. I have to have a CT and X-ray tech. I've got to have a phlebotomist available. So you have to pay those people, right? So that takes a lot of money, plus the cost of supplies. Supplies have gone up, right, lately. So we try to encourage them, you know, like next time if they come in about their bill, it's like, well, you could have seen this physician, or here's this resource for you next time, you know, but we try to really get them to establish with the primary care provider, you know, so that way they have a resource to call, like if they're feeling sick, what should I do? To help make those decisions. But Jake is correct. I've heard families out in the lobby saying, well, we're at the ER. You know, I just felt better having mom or dad brought to the ER. And he has to call 911. So He has to have an ambulance, pick the patient up, drive what, 50 yards?
Yeah.
50 yards, and then they back up. And then we have to call EMS again to take them back to the nursing home.
Do y'all have a family education program that would help debunk some of these thoughts? I mean, some of it's just old school, go to the ER.
Yes and no. Yes and no.
So I'm sorry to interrupt, but we are 15 minutes off of what we said we would keep people. And I just wanted to let Edward have a chance to talk about what's coming up for the city for community facilities. And I did want you all as community members to, talk about your ideas for about 10 minutes and then just put the sticky notes up because, that's the way we gather information. This is fantastic, but I want to be respectful of everybody's time. I don't want to go too much over. And I apologize for losing the first 15 minutes. If you all want to stay past 1 o'clock, I don't know what everybody's schedule is here, but I want to make sure that they had a chance to kind of give you the information before you all kind of went off and did this community forum, that part about the comp plan to get the ideas from the community so that we can put that into the comprehensive plan. So if you want to 5 minutes and then. Yeah.
Know about the wastewater treatment plant?
Yeah, we'll make it kind of quick. Yeah, so we know of course, we have 2 wastewater treatment plants that need to be upgraded and moved. Drainage, we are working constantly around everywhere, and y'all can see it down on 2nd Street and everything. They're putting in drainage pipes and everything everywhere. We're trying to get it all over town so we can get this water to move. Water doesn't move when you're in a bowl, so we have to get it to go somewhere. Detention ponds, same thing. We're, trying to add more and more. We actually got another one started out on Loop 230 right now, that they're building and stuff. So, but looking at the map, we need at least about 4 more around town, at least to get things moving and stuff. So working on that. I can see in the future, our electrical lines are going to have to be upgraded. We have a lot of lines that have been out there for many, many years. Still a lot of copper wire laying up there and stuff. And with all the new growth and the residential people coming in, that wire is not going to be able to hold anymore. It's just going to, come down and everything. So everything needs to be reconductored and stuff through there. So I can see all that coming. Of course, roads, sidewalks, all of that's coming too. We're working as we can, but need sidewalks around here with all the kids and all the people moving around and everything. And, it's tough to have them walking on the roads. So we're trying to get sidewalks put in. And last but not least you can see down the road, we got the new innovation center coming in, being built as we can. So hopefully that will help, get a lot of the community in to, help, get trained, get jobs, maybe work local here with us or whatever and stuff. But we're excited about it. So that's what we're working on right now as we speak.
Well, and another entity, Carts, is also building their new.
Yes.
And they plan to be able to host training and classes and
That's true. Yeah.
meetings and stuff. So that's going to fill a big need. Okay, I think to kind of put this in 5th gear from 3rd, maybe if you've got a favorite idea that's come out of this discussion or you brought one with you, we could do it that way. Or if you want to, talk at each table, given that we're 2 at a table or 1, we could just do this as a group. And I think that might be then, bring your idea up and we can all kind of analyze it with you instead of you sit there by yourself with somebody else. Oh, yeah, please.
Okay, briefly with the situation with the airport, talking about growth and so on and so forth. And it's all the same with everyone else is dealing with. Austin's growth coming this way. The only big difference is in aviation, that takes into account all of Central Texas is having this growth that's every airport, when you go all the way around Austin, Georgetown, Lago Vista, Lockhart, San Marcos, Smithfield, Giddings, LaGrange, all these airports are experiencing the same issue. huge growth, shortage of hangars for aircraft storage. And then, of course, all the businesses that go with those, that growth, corporate aircraft, flight facilities, flight schools. Okay, so Smithville, we'll talk. We typically, in the last few years, we're experiencing 12,000 takeoff and landings a year. This year, we have a new program connected to a small radar system that I keep track on the computer of daily takeoffs and landings. We're looking at this year exceeding 19,000 takeoff and landings at Smithville Airport. So what we're limited to at the size we are now with a 4,000-foot runway, and we only carry aviation fuel, which is avgas, gasoline. We have no jet fuel. And with our size runway, it limits the size of jets that come and land there. Businesses, more and more coming. Tourists come regularly. People, let's say, going to the Hyatt Regency.
Then for Coda.
Oh, yeah.
Yes.
Especially when there's races out at Coda. They come in, and then more and more businesses, even people in smaller private aircraft come in. Lawyers frequently come in from around the state that have business in Bastrop. We are the only airport in Bastrop County. So we have, I'll make this short, we have a grant that is gone through, approved, and the city's paid their share is $1.5 million grant to remove and replace all the lighting at the airport this year with LED lighting. So it'll be a cost savings in the electrical bill at the airport, long-term, last longer. And then a year and a half from now, we're in line for the parallel taxiway to be completed, about $3 million grant. And then after that, another year and a half, we're in line to get the runway extended 1,000 feet. That'll put the runway 5,000 feet, and that will be acceptable to larger corporate aircraft, not airliners, but larger corporate aircraft that, because of insurance reasons, they can't land on what we have now. That's about it.
Yeah, that was our problem in Port Aransas is the airport was set up and the runway was next to the wetlands. So we had to, I mean, that was a big issue to try to, we only needed like 300 feet or something to get long enough. We couldn't get it past because it would have extended to those wetlands, but that's great news. And that's going to make the airport way more competitive in the region. And I understand there's more pilots being trained. My son just got his pilot's license. Just because he did.
And you hear it on the news all the time with the shortage of air traffic controllers, the shortage of pilots, a huge hiring boom in that area. And from like when I started flying 50 years ago, yeah, a pilot hoped to get hired. Now that it's so much easier, and the starting pay is like everything else, so competitive. So it makes it well worthwhile.
Yeah. So you see why I'm excited about the airport and how it's going to affect the next 20 years. It's going to be, some things we don't even know yet because it'll just put other things in place. All right, we want to do our exercise, and if you've got an idea or something we want to post, bring it up, talk as a group, or you can just do it anonymously and silent and we won't look.
Okay, community facilities. There are a couple things we haven't discussed that I would consider a community facility, but maybe that's a different forum. Libraries, rec centers, parks. We haven't.
That's what we're going to have
That's a different one.
No, we're not even, Jill and I are going to talk about, probably we'll have a public facilities and infrastructure forum and kind of drill down into, community, not community, but city owned and county owned emergency management kind of stuff. So I think, trying to do all this with these guys, each area should be a chapter in our plan. So, But anyway, if y'all want to talk and write and add your things or bring up another idea or question while they try to eat.
I was just curious, I'm sorry, regarding the airport. I think all of that is just amazing. However, there are communities that are currently coming up in that area. And I'm sorry, there are communities that are currently, as we speak, coming up in that area, new communities, houses over $700,000. There are communities that have been out there for a long time. And I know that, the thought is to expand that part or to go and buy some additional property and to just rebuild the airport. Is that the idea? Okay,
Never been discussion of buying property and rebuilding the airport. The
okay,
airport owns enough property to expand
okay,
the length of the runway. There's a 25 acres tract of property at
Okay.
the south end of the airport that's totally open, just has cows on it right now.
got it. So
Mhm.
this is just a thought that I had, how is that if we plan on having larger aircrafts come in, not jets, but larger aircrafts coming in, how is that going to impact the community that's already there? Because I currently live out there and sometimes I think a plane is getting ready to hit my house. It's so close. I don't know if it's the person that's driving the plane or flying the plane. I don't know. But I think for me to live in a community where it's close to the airport, how are we going to be able to combat that? That's almost, to me, the same situation that they had in Austin at Manor, off of Manor Road, where they had all of that. Have we thought about moving it? I know it's going to be costly, and I know you said that they have a lot of property, but have you guys taken into consideration the noise ordinance?
Right, yes. It's-
Okay,
We've discussed that at airport board meetings and considered it. In totality, there are very few complaints. However, that said, we do get complaints and we try to address them. For instance, there's a individual in town who regularly complains to me, the city manager, and the FAA. In response to that, and I have a way of tracking the exact path of each airplane that takes off from the airport, exactly how high they are and where they are. And from that, I can see that individual complaining is incorrect about the altitude of that aircraft. They are at a safe legal altitude. That being said, we have contacted the flight schools from Austin, Georgetown, San Marcos, and New Braunfels that regularly come and use our airport and have notified them where they should be turning out away from the area so that they're not right over inhabited parts of town. Most of the time they follow that. Every now and then we get a new flight instructor involved and he's not aware of that, and then I have to address that. But we work hard at that. Now, flip side of that, being devil's advocate, me being the devil that I am, I always tell people when they call, I said, how long have you lived there? And they say 5 years, 10 years, 15. I said, do you know how long the airport's been here? Most people do their due diligence when moving somewhere to find out what's in the surrounding community around them. The airport's been there since, 50 years ago, and airplanes have flown there. Yes, we've got much more air traffic now, and we have the Air Force come and train there regularly. The Navy comes and trains there regularly, and the Air National Guard does. So those are things to me that are all a positive plus thing. But it also creates more of a noise factor. So we try to limit that, but at the same time, we try to keep that all within the regulations that the FAA requires. Whenever that or someone breaks that rule, let's say, I'm on them about it, as long as I know it. And I can go back, like I said, in our We have a thing called Virtual Tower, which is a radar system that keeps track of every single aircraft. That's how I know the numbers of how many come take off and land. But it also gives me the tail number and owner of that aircraft, so I can contact them.
Just to let you know, I've never complained.
That's okay. Plenty others have for you.
What would be the impact on the when the Arctic?
Actually,
Are they make
landing, they're very quiet. Taking off is where all the noise is, and it just depends
low level?
on the wind and the particular aircraft. The T-6 Texans that the Air Force trains in here, it's a turbine aircraft that comes in low, and they do a touch and go, and it's a lot of noise, but it doesn't exceed noise levels to a point that are acceptable by law. So that being said, and they use multiple airports for training, and we have a memorandum of understanding that we sign with them each year to permit them to do so. I'm proud to have them here and use us as another training.
But that's something we'll also keep in mind is what impacted with your growth, what's going to be around it and everything. Okay, with the point, with what? Do you want to bring up your ideas or just post them or?
Partnership with a developer for hangar housing? Create a partnership with a developer for hangar houses?
Question is regarding hangar houses in a partnership development. It's typically referred to as a through the fence agreement with property owners next to airports. So this came up several years ago, and recently it's come up again because a property owner next to the airport had asked about a through the fence agreement. I belong to the Texas Airport Council, and I went to several meetings where I brought this up, and I continually got negative response of the downside to doing so. About the only airport that I could find that had a good response in that whole topic was at West Houston Airport, which is off I-10 near Highway 6. Was a very remote area 60 years ago when they built that airport. Now it's completely surrounded by houses, subdivision, shopping malls, etc. Their only comment was that the corporate hangars built next door to the airport pay such an extremely high fee to make use of the through the fence agreement. Basically, that means they can come from their hangar through the property line or fence line, build a taxiway to join a taxiway, and then get on the airport runway. And that was the only possible way that they said they would be supportive of it. The FAA has mixed emotions about it, but all in all, the information Robert Tamble and myself discussed about it, it's just a lose-lose proposition.
Do you have helicopter traffic at all?
We do, mostly the Army, but we had a helicopter flight school until a few years ago, and they just didn't have enough students to make it profitable. However, we do have a fixed wing flight school now that is very busy and growing. Yeah.
Okay. Anybody else want to discuss? I'll turn it over. Thank you, guys. I appreciate it. Sorry for the time adaptability, let's call it, resilience. We were very so we've tried.
Okay, and thanks again for everybody. And thanks for going over a little bit and giving us that little leeway with the technical difficulties. Thank you all so much for coming in and sharing all that information. If there are any questions for anybody, I can funnel it, just let me know and I'll get an answer for you from anybody up here. We will be doing some more community forums. Pamela Knoll is here. She's going to lead the next one, which is we're working on the date, but it looks like it's going to be February 25th. So we'll we'll do a confirmation on that. That's going to be on historic preservation and cultural assets. So that'll be one more of these chapters, like Tim alluded to in our comprehensive plan. We'll have another set of experts talking about historic preservation and cultural assets, and have that community back and forth as far as the ideas that might be coming out from that program as well. So thank you all for being here. And please, if you have any more ideas, we'll do put them up, and let me know if you have others that kind of pop in your head in the next couple of days. Be happy to bring that all over to Tim, and really appreciate you all. Thank you.